Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning everybody. I'm grateful for opportunity for me. May I introduce myself? My name is Wuri Ratna Hidayani from Stikes Respati, Department of Public Health in Tasikmalaya, West Java, Indonesia. I have member Mr. Haidir Safrullah and Miss Elisa Tiasih Rosali. I would like to present the article by title Analysis of Knowledge of Senior High School to Singaparna Student about Epidemiology of Sexual Transmitted Infection and Lesbian, Gay, Bisexual, Transgender in 2019. Background. In 2012, there were 357 million cases of sexually transmitted infection in the world. In Indonesia, in 2016, as many as 61,000 cases. West Java was the highest rank of STI in 2012. In 2016, the highest prevalence of STI was gonorrhea, 3,430 cases. Several independent surveys state that Indonesia has 3% of LGBT population or around 7.5 million people with LGBT of 250 million people in Indonesia. Preliminary study in December 2018, counseling guidance teachers state that most of the knowledge of high school students did not yet understand the epidemiology of sexually transmitted infection and LGBT. It is feared that students do not know the preventive risk of transmitting sexually transmitted infection and LGBT behavior. Method. The research method uses qualitative design. The population in the study were all children of senior high school to Singaparna. The sample of this study was students of class 12 by purposive sampling 29 students. Data collection using questionnaires and in-depth interview. Data analysis was carried out from information that was obtained at the stage of research data collection from the result of interview and open questionnaires. Result E. Knowledge of STI epidemiology. Tried epidemiology. Epidemiology of sexually transmitted infection causes by viruses. People at risk are commercial sex workers. Sexual deviation include children. Homosexual or M is M, men like men, lesbian. The STI environment is largely by changing partner behavior, injecting drug by senior high school to Singaparna children. STI risk factors. Risk factors for sexually transmitted infection are partner, changing behavior, drugs abuse behavior such as injecting drug, sexual deviation such as sodomy, rape, unsterile blood transfusion, or virus contamination by senior high school to Singaparna children. STI classification. Sexually transmitted infection are HIV or AIDS and uterine cancer. STI classification is HIV or AIDS, syphilis, and gonorrhea by senior high school to Singaparna children. Knowledge of LGBT. Definition of LGBT. LGBT, lesbian, gay, bisexual, transgender is deviant behavior that violates religious norm. Lesbian is a lover of the same sex, namely woman like woman. Gay is a man who likes the same sex between men and men again. Bisexual is lover of all types, so likes both between men and women. Transgender is someone who changes genitals such as woman into men. By Senior High School Chu Singaparna student. Next, causes, impact, and prevention of LGBT. There are so many causes of LGBT, not only a matter of lack of faith, but because of education and the surrounding environment. Not a few LGBT also occur because of the concern for someone and dissatisfaction with the nature that should be. The impact of LGBT on the surrounding environment that is contagious. LGBT can damage the nation's future. Impact on oneself that can be alienated by his friend or become material for bullying. LGBT can be prevented by several things, including deepening the fight and piety, deepening knowledge about LGBT, knowing the impact of LGBT. By Senior High School Chu Singaparna student. Prevention is the right parenting and encouraging faith according to the following information. The cause of LGBT is the association that causes LGBT. Poor socialization of the community, loss parental supervision, environment, lack of confidence. The impact of LGBT among other causes the large number of LGBT communities, undermining the morale of the nation, can destroy the present and future generation. Prevention of LGBT among other faith that must always be instilled early on. Parent educate a child by instilling Islamic Sharia. Parent educate their children according to the sex of the child. That is from the game or by educating hard on boys. Parents must instill good moral from an early age. Love, unfortunately, from childhood is the base of the success of children in the future. Parental supervision must be observant of the child behavior or if there is a change in behavior in children. By Senior High School Chu Singaparna student. Discussion. Based on the research result of 29 students, it can be seen that the student knowledge about STI epidemiology is still limited. Only a little is known about STI epidemiology from the agent aspect. Only fixation of HIV or AIDS, which is transmitted by viruses. Apart from environmental factor, most respondents answered only at-risk sexual behavior. Encouraging the role of teacher in motivating students, especially guidance counseling teacher, to continue to socialize the importance of students in understanding about LGBT. The role of homeroom teacher and subject teacher, as well as to participate in socializing about the danger of LGBT. The role of religious teacher also continues to be improved to guide students in encouraging faith and piety so as to provide a firm foundation with a strong religious provision. The principal policy is also very important to create and a religious school for the circulation of religious values for students so that students are not easily influenced or thinking that's drag on behavior that violates the norm. Conclusion. The knowledge Senior High School to Singaparna student of STI epidemiology, namely student only know the STI disease again, which is a virus, whereas STI again vary including viruses, bacteria, parasites, and fungi. Risk factors that are known to students are behavior, sexual deviation, and blood transfusion without screening. The STI classification that students now only mention the STI classification as HIV or AIDS. Only one person mentioned HIV or AIDS, uterine cancer, syphilis, and gonorrhea. The knowledge of senior high school Singaporean students about the danger of LGBT, namely the majority mentioning the length of LGBT without knowing the meaning of the term from LGBT. Student knowledge of the causes only mention wrong pattern of care, lack of faith association, event drop. There are still many factors causing LGBT. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.